Kuzangpo, and a very warm welcome to the Current Affairs program. And as the general public must be knowing that every year the 3rd of December is observed as the International Day for Persons with Disabilities, and this year also the day will be observed on 3rd of December. And this year the theme is promoting the participation of persons with disabilities and their leadership, taking action on the 2030 development agenda. And to talk about the International Day of Persons with Disabilities, the challenges faced by the person with disabilities, and also talk about the National Disability Policy and the initiatives taken by the service providers and how they are looking into and community inclusion with persons living with persons with disabilities. I have with me Dr. Sangadoji. He will represent person with disability, the community. And then I have with me Tashtoji, the Deputy Chief Research Officer from the Research and Evaluation Division, GNHC, Gross National Happiness Commission. And then Ugemongshu, the Executive Director of Ability Bhutan Society. And then Karma Funso, the Deputy Chief Physiotherapist from the JDWNRH. Welcome to the show. Now, first of all, we'll go with Dr. Sangalat. Now, you yourself being a person with disability, what are some of the major challenges that you face in the community?
Thank you, La. Thank you very much for the opportunity. I think it's quite a difficult question because me as a person with visual impairment, my challenges were quite different from if someone was on wheelchair or someone is hearing impaired. But me as a person with visual impairment, especially when I was a young boy, it was the biggest challenge I had was facing the people not knowing how to communicate with me not knowing what to ask, and even if I were taken in a new place, then even finding my own toilet was a big challenge. If made accessible and if made everything properly marked and oriented, I think the challenge would be not, there but much reduced. I think that's in a nutshell, but if you really go on the challenge as a person with disability, it will really be as big as the national challenge.
Yes. GNHC, now there is going to be this National Disability Policy in place which will be launched soon, I believe. So what are some of the benefits that the person with disabilities can derive, the benefits that they can derive from this national policy?
Thank you so much. Thank you for providing this opportunity. The policy for the National Policy for Persons with Disability. With this policy, now what we will have is a coordinated interventions for the persons with disability. The services that the government will provide will all be coordinated, and also there will be specific programs and activities for persons with disability. And also this initiatives for the persons with disability, this will be mainstreamed into our development plans and programs. What happens right now is all the services provided are provided by the specific sectors. For example, Minister of Health, they provide their own services to persons with disability. Likewise, we have Minister of Education, and we have the CSOs for providing services. They are providing on their own, and there are not so much coordinations. And our development plans and programs do not have these service provisions already integrated, not so much integrated. So with the new policy, we will try to integrate these disability initiatives into our plans and programs, so like 5-year plans and programs. And it will also be integrated into all the policies that we review.
Yes. That's now ABS as one of the service providers. What are some of the initiatives that you all take so that the persons with disabilities are included in the society, like inclusion?
Yes, thank you. First of all, I would like to take this opportunity to thank BVS for arranging such an important issue which will bring a lot of awareness and sensitization among the public. However, as highlighted by Mr. Tashi here, the services that are available for persons with disabilities, firstly it starts with Ministry of Health, then Ministry of Education, and of course we have 3 CSOs, public benefit organizations, and out of which Ability Bhutan Society is one. So as much as our organization is concerned, we are specifically focused on children from 0 to 5 years, so which is why the general curriculum available with the education is not really able to benefit this group of children. So which is why our organization takes into consideration of providing the early intervention services to children in terms of communication, behavior, then in terms of toileting, then socialization. So likewise, since its inception 2012, our organization has now, starting this year, extended to 5 other Dzongkhaks, namely Chukha, Dagana, Punakha, Sarpang and Tashigang. And we have a project supported by Federal Ministry for Economic Cooperation and Development, Germany. And we have German Leprosy Relief Association based in India. They also call as DAHW. And besides that, we also have Disabled Persons Organization of Bhutan, whereby they facilitate in scholarship, training and employment for youth who have completed their education. And of course we have Drakso, Vocational Institute for Special Children and Youth, basically imparting the vocational skills and employment.
Yes. Well, from the health side, how are you all looking into integrating persons with disability to rehabilitation services?
Thank you very much. When it concerns health, disability is not actually only the result of health impairments, because disability is resulted in the process when an individual with health impairment come into contact with the environment. But when it comes to rehabilitation services, in every health facilities, we are starting with trying to take the rehabilitation service as close to the community as possible. For instance, one of the approaches of rehabilitation is community-based rehabilitation. So, for example, in the communities where we have basic health units, and then our primary healthcare workers who work in these health units are aware and they know how to identify people with a range of impairments that could be long term and that could hamper their participation in the society. So if at all possible, through various health interventions, including assistive technology interventions such as fitting a person with a wheelchair, for instance, or providing some assistive product like crutches or walking aids or hearing aids for that matter. So with this intervention, so we are, the health is looking at trying to improve the function of a person with disability, and then thereby their participation in the community or society is enhanced, and then and their acceptance in the community becomes more obvious, and then they're accepted very well, and that's our objective of or the plan of integration as we would like to achieve.
Yes. Yes, Dr. Sanga, now if you could share your view as on how inclusive our community has been over the past years. Has the stakeholders, agencies or the government been very considerate in looking into the problems that the persons with disabilities are facing?
I think it's improving. Of course, the physical terrain itself makes especially physically impaired persons or persons with physical impairment difficult. But overall, I think our advantage is that we are a small community and our system is well built. For instance, if you think of health, if the Minister of Health issued a circular through their district health officers, or Education Ministry circulated circular through the DEOs, then I think our communication compared to many of our neighboring countries is good. But our challenge is, number one is the physical environment. Number two is, of course, the human and financial resources. But overall, since the School for the Blind was established in 1973, now I think it has gone quite a long way, because only a few weeks ago, when we, even as a visually impaired person, we tried to observe White Canes Day on 15th October, there were almost 60 to 70 visually impaired people in Thimphu itself. when I joined my service in 1994, I felt I was only a blind person in Thimphu. And even the people, if you can initiate or if you can if you are proactive, I think people normally they don't ignore you. But at the same time, people's lack of attitude, lack of knowledge, and then also feeling that sympathy instead of empathy, I think it's a big challenge, and the facilities are a challenge. But other than that, it is improving, and I think still long way to go. That's what I feel.
Now with the National Disability Policy, GNC, are these issues looked into, for instance, the physical environment, education services that they should avail, are these looked into?
Yes, the national policy for the persons with disability, it's a very comprehensive policy which covers a wide range of themes and also wide range of the activities that the persons with disability will take. For instance, coming in contact with the physical barriers, then education, then access to justice. So everything is looked into, everything. So now the policy is very comprehensive, but the policy will not address all this issue at once. We will not be able to address immediately, but the policy will be implemented gradually based on the availability of resources, then also the availability of the capacities of the implementing partners, for example. So now what we are trying to do with the policy is first look at something that is very doable, something that do not require resources, financial resources so much. For example, just changing some of the policies in the other aspects. For example, education, making an inclusive educational policy do not require so much of resources. For example, admission policies for persons with disability, children with disabilities, this does not require financial resources. And also, for example, just giving a priority seating for persons with disability during the national events, or for example in the statues, just providing them guidance or support do not require so much of resources. So that's how the policy will be implemented, and it does look into all aspects of the persons with disabilities interaction in the communities as a whole.
Now, EBS being a service provider, now what are some of the challenges that you all face?
Perhaps if I mention organization in particular, it may be wrong, because first and foremost thing, what we have to understand in the society, disability is not a disease which can be cured by giving an injection or by medicine, or as rightly mentioned by Mr. Karma, it's not contagious rather. So when we say challenge, now specifically Ability Bhutan Society as an organization, I may not be fair because this is overall arcing challenges. So first and foremost thing is, since disability is a cross-sector approach, many do not understand, until and unless one has a disability, a child with disability or a person with disability in a family, or having not having worked with persons with disability, it's very difficult issue to understand. However, what I would specifically mention is, disability is something like people believe, it's a result of past karma, Perhaps because of that we have less acceptance within the family, in the society, and the outlook and the approach towards people with disability itself lacks awareness and sensitization in the society. And of course, next one is quite, I would say, is a discrimination, and specifically women and girls with disabilities, and of course the lack of human resources, because we have a different spectrum. For instance, a child with autism, of course we may name it as autism, but we have different spectrum in the autism. So the challenge faced by a child A may not be the challenge for child B. So which is why it is very, very tough. And of course, being a CSO and NGO, to provide free services is one of the biggest challenges we have is the lack of funds, So these are some of the burning issues that we have in the CSO fraternity.
That's, again to yourself, that discrimination, especially among the women and girls, why so?
Just to give an example, like today the panel is itself is double discrimination, we would say. So rather, like, firstly, the discrimination itself face lot of people with disabilities in the society face lot of discrimination, and of course we have particularly women and children. They are more exposed to abuse, neglect, and physical abuse, then sexual abuse, and so on. So which is why people of course we may not generalize, however, even in social media, in the mainstream media, it is quite visible. So especially women and girls, they are more prone to discrimination.
Yes. Let's to the health now. Disabilities comes in all forms. So is early intervention still a problem?
I would rather say challenges are there, of course, with the advance or increasing, improved technology in the health sector. Probably these are some of the things that we would be able to really identify early and then prevent or minimize the effects of the particular health impairment, and that may contribute to disability. But then, over the last couple of years, actually, a lot of effort had been given to early intervention. Really, when you talk about early intervention, the crux is really trying to get hold of the problem right from the beginning. So if we are able to identify a problem or a health impairment right from the beginning as early as possible, then the interventions thereafter will help prevent altogether disability, or at least minimize the effect of that impairment, and then reduce the disability altogether. And then I would like to draw in this, because children and women, so especially in the child health care side, the Ministry of Health do have a public health program specifically looking after the child health, and then we have qualified child health specialists in the hospitals. So and the human resource in this area, although scarce at the moment, are on a steady rise and improvement. So thereby, when it comes to children, so if we are able to identify the problem and impairment right from the beginning, then appropriate interventions could be carried out, and then thereby prevent disabilities or minimize. And then when it comes to women, discrimination is faced by women more, from the health side. Most often the health service requirement of women is more complex, and then even more than the men with disability. And then that's why the challenges in our health sector most often is that our health workers are most often, they do not know how to handle or interact with the individuals, or especially women with disability, and then thereby, not intentionally, but because there is no awareness and knowledge, and sometimes, unintentionally, they, most of the people with disabilities, and especially women, they feel discriminated or get discriminated.
Yes. Dr. Sanga, do you ever feel discriminated?
I think discriminated, it depends how you define. If you know how to handle the people, and if you are a contributing member of this society, I think discrimination is maybe less. But as a person with disability, sometimes, especially in my journey as a person with disability, when I first lost my sight when I was 8 years old, till now, which is now almost 40 plus years ago, I think my discrimination has been quite drastically reduced. Initially, discrimination normally is not because they want to discriminate. It's just that I think they don't know how to approach a person with disability. Because even if you want to talk, for example, in a long time ago when I was studying in UK, there's a program called Does He Take Sugar? Which basically means that instead of asking the person with disability, does he take sugar in the tea, they want to ask the person who is next to him, or guardian or the parent. So likewise, it's not that they want to discriminate. It's just that they don't know. That's why I think this awareness program, advocacy program, sensitization, these are all important, because it's people, as a Buddhist country, as a closed society in Bhutan, I don't think people want to discriminate just because they are disabled. But basically it happens because, first of all, they don't know how to approach. Number two, I think even our own family members, out of frustration or out of worry, concern, I think they become, but we put it in the other word saying discrimination. Either you can put it as a positive term, concern, or you can put it as a negative term, discrimination.
Yes. To GNHC now, one of the biggest challenge that a person with disability face is also getting employed now. Does the policy also look into like how they can be made employable and how the private sectors and the government agencies can employ them?
Yes, the policy covers the employment part, and particularly we have it as an economic security for persons with disability. So here, first of all, we are talking about the employment for persons with disability. And here specifically we are saying Ministry of Labour and Human Resource should provide training opportunities or building capacity of persons with disability, providing them entrepreneurship trainings, for example, and then also making the workplace accessible. And that will start from the public sector, for example, from the government offices, making it accessible for persons with disability, then moving on to the private sector. And for the private sector, we are not right now imposing them to make it accessible, but in the policy we are saying the government will incentivize the private sectors if they make the workplace accessible. Or maybe based on the performance, the government might incentivize them if they employ persons with disability. And also we are talking about the giving business opportunity for persons with disability. Now the policy specifically mentions saying that the persons with disability should be provided with designated area for businesses in the public facilities. For example, in Thimphu it could be the Centenary Farmers Market. There we could easily provide a slot for the persons with disability if we take initiatives. So these are some of the things that we can do. And also giving the trainings to, and then providing trainings to the management of the public facilities, how to approach persons with disability, like what Dr. Sangha has mentioned. Now, most of the duty bearers, for example, service providers do not know how to approach, how to take care of persons with disability, and also they do not necessarily know the challenges and needs of persons with disability. So we need to provide such programs, such trainings to persons with disability. So in that aspect, yes, employment and business opportunities are covered in the policy.
That's to ABS. How are our people aware that there is an organization called ABS, and are they willing to avail the services that you provide?
If we trace down to the inception of this organization, Ability Bhutan Society started with 8 children initially, and as of now the total of 222 children with disabilities have availed our services, and out of which 38 of them have successfully mainstreamed in the schools. So when we look at, because in the earlier terms there were as such no social media quite popular among the public, mainstream media also did not have well covered the services available for people with disabilities. So now with the time, with the advent of social media and other media, through our personal and network connections, the services like Ability Bhutan Society provides, the services that other 2 organizations like DRAXO and DBEB provides is getting known. And which is why, like today, this year we have 26 children with different disabilities from moderate to severe in our organization. So what I feel, of course not as such the study has been conducted, however through our social media contact, person to person, then through other means people are becoming aware of the services available for persons with disabilities, and particularly like ABS is successfully, with the support from, as I mentioned, from the German government and GLRA, we are able to now take our services outside Thimphu, in particularly like 5 Dzongkhas based on the prevalence of the disability.
To the health, what we heard before, and we also did several stories before, like people fear to avail the services being provided by the service providers, fearing the discrimination in the society. Does this still happen?
I think the social stigma is still there, although that's one of the reasons why we are not able to see many people with disabilities around, especially in in the towns and in gatherings, and most often this is construed as just because we cannot see, there are it does not exist. So, but then the reality is, yes, discrimination is not really intentional, which may be there, by the way, in most parts of the in some corners of the countries there, in communities, we believe there are still social stigmas and discrimination. But then when it comes to hospitals, like Sanga sir said, it is not really a direct or intentional discriminations when a health worker is providing services. It is really the inability or the lack of knowledge with that particular health person, for example, to really interact and deal. For example, a person who has no speech is availing a service, but he can only communicate with the health worker in sign language. But then on the health worker doesn't know how to communicate in signs. So this way, so he is not able to really, effectively provide service, and then that may be interpreted as some form of discrimination.
Since we are out of time, last to EBS now, if you could just briefly talk about the importance of observing the International Day of Persons with Disabilities and the activities that you all will be carrying out.
Well, one of the objectives of observing such International Disability Days, one is on 3rd December, of course, International Day for Persons with Disabilities. However, we do have other International Disability Days being observed, like Autism, International Autism Day, then World Down Syndrome Day, and likewise Cerebral Palsy Day. So basically, these are to reach to public, So the importance is really like, firstly, to create awareness among the public. Secondly, to make aware that such facilities and services are available in the country with, of course, a lot of challenges that we shared. Besides the challenges, there are numerous agencies and organizations which are providing the services, and the services are being made available. So as such, like particularly on International Day for Persons with Disabilities, we try to showcase the talent that people with disabilities have. For instance, in 5 Dzongkhaks that we have extended our services, we have a plan to have a 1-week talent show by people with disabilities. Likewise, now we have, like this year, we have conducted an art competition among the university graduates, students, to have more awareness. So this is mainly to integrate, to enhance the social inclusion.
Lastly, to health now, the activities that you all will be carrying out to observe the day, very briefly.
Over the last few years, we have been collaborating with CSOs and NGOs, and then we have had the principal objective is to really, again, to raise the awareness on persons with disabilities and what they can potentially do and contribute as active member rather than passive recipient of services or whatever services that are available from many sectors. So basically, it is to really become active contributor and participants in the society.
Last Dr. Sanga, it would be unfair for me if I don't let you talk. So your message for the day?
I have 2 messages. One message is that disability is not like our arms and legs. It can happen anytime. So anybody who is watching the television, just think that you are not doing something for person with disability, but doing for yourself. For instance, now we are using cars and so many machineries. It can cut your arm, or it can injure your eyes or hearing. So just preparing something for someone with disability, it will help you, number one. If that doesn't happen, when you become 85 years, you are person definitely multiple disabled. So even if you build a small, simple, your own home, make it accessible that it can be used comfortably even without your own children when you are 85, 90 years old. So prepare yourself for your old age. If that happens, then every disabled person will be accessible. And even when we make facilities or services for disabled person, it will not be used by just disabled person, but by everybody with ease and comfort. So even the policymakers, politicians, everybody should think that we are doing for yourself, not for a person with disability. And even 3rd December is not a stop there, it's a starting point. So International Day has been observed just to make it starting point. So 3rd December complete, don't stop it there, so continue.
Let's thank you so much. With this, we come to the end of the program. And like Dr. Sangha said, let us all support persons with disabilities, because as Dr. Sangha said, disability can come to anyone at any time. So thank you so much for your time.